States that never locked down at all, states where people were allowed to live like Americans and not cower indoors alone, in the end turned out no worse than states that had mandatory quarantines.
As you look at all the data all around the world where people have come out of lockdown, things are actually going along quite nicely on the whole.
There's a lot of studies coming out that question the validity that social distancing and mass quarantines will slow down the virus. At least it's debatable.
There is still no science or data at all after 2 months that these lockdowns have done very much to halt the spread of this virus. Sorry.
Does it work? Yeah, we're seeing in China, in South Korea, elsewhere, these kind of efforts make a difference, and we're seeing a slowing of new cases. So yes, it matters.
The science behind the 6 feet is completely sloppy and what I would call lame.
Social distancing doesn't work, quarantining doesn't work, masks don't work.
So certainly we have seen a plateau, a decrease in the numbers from China and South Korea. That's encouraging. It tells us that if you follow these measures, now granted those were aggressive and they had more testing, you can slow it.
And by the way, there's not a lot of evidence that masks would help.
There is zero science for having children wear masks.
Now, we've already showed you how the science behind the mask mandates is shaky.
But we don't actually have the studies to prove how effective it is.
These images show the airflow when someone breathes or coughs without a mask, and this is the airflow with a mask. Research already showing masks can work, like this study, which found mandatory mask wearing in 15 states in Washington, D.C., possibly averted up to 450,000 COVID cases.
From a medical and a common sense standpoint, the decision to put kids back in school should be a slam dunk yes.
We need the schools to open. The risks will be very low in New York.
Children, for some reason, are at very low risk of coronavirus and are at very low risk of transmitting the coronavirus.
Teaching is a young profession. They have almost zero risk from this.
Opening up the colleges and opening up the schools is a totally fine thing to do. Young people are not dying from this virus.
Children are not meaningful vectors for the coronavirus. Worldwide, there is not a single recorded case of a student infecting a teacher with the virus. Not one case.
A CDC study identifying 12 children thought to have been infected at child care centers who went on to infect 12 others, including parents and siblings.
Hydroxychloroquine in the laboratory looks like it does have some effects against COVID-19.
Some recent studies are showing the positive effects of hydroxychloroquine.
Hydroxyhysteria has been around for decades. And it's something really the FDA should have stayed away from.
There's a cure, there's treatment for early COVID disease, and that's hydroxychloroquine and zinc. It's very straightforward.
I know of no evidence base to suggest that hydroxychloroquine would be good for the prevention of COVID virus infection.
In fact, lockdowns and mandatory mask mandates are probably slowing the onset of herd immunity.
We might reach herd immunity at much lower rates of infection than the 50 to 70% that people have speculated.
Vaccination creates artificial herd immunity. It looks like natural herd immunity is already developing.
Denying herd immunity is like denying gravity. Gravity exists and herd immunity exists.
Herd immunity is a terrible strategy, and I know that there are people who continue to advocate for it. And let me just first make the case for why it's a terrible strategy. To get to that, for this virus, we think you're going to need to get 60-70% of the population infected. So it would be 10x number of people infected of what we have right now, and 130,000 people have died. So if you do a 10x on mortality, that's 1.3 million deaths. Even if you say, well, it won't be that bad and we're going to get better on treatment, it'll still be many, many, many hundreds of thousands of people dying and many, many millions of people getting very, very sick.
Now we know more about this virus. Extremely low lethality or otherwise healthy younger Americans, they do pretty well.
We want people who are generally healthy to actually contract COVID if they do naturally.
For people aged 1 year to 69 years, the survival rate post-infection with COVID is over 99%.
If you get it, there's a very good chance, almost a guaranteed chance, if you look at those numbers again, around 100%, that you will survive.
We do know that some people will have long-term negative impacts on their brain in terms of neurological changes like impaired taste, impaired smell, impaired concentration. And some people will end up having disorders like depression and PTSD, post-traumatic stress disorder. If you're not making a quick recovery, start to seek help.